Seeing as how I've been having problems with my videos and my audio, I'm trying a different program. So let's see how it goes. I found a really good article on borderline personality disorder. It's from the National Institute of Mental Health. I'm going to leave the link to it down in the description. So if you'd like to go and review it, you can. But I just wanted you to know that's what I'm reading right now. So borderline personality disorder is a mental illness that severely impacts a person's ability to regulate their emotions. This loss of emotional control can increase impulsivity, affect how a person feels about themselves, and negatively impact their relationships with others. Effective treatments are available to manage the symptoms of borderline personality disorder. Learn more about the disorder, how it's diagnosed, and how to find support. What are the signs and symptoms? People with borderline personality disorder may experience intense mood swings and feel uncertainty about how they see themselves. Their feelings for others can change quickly and swing from extreme closeness to extreme dislike. These changing feelings can lead to unstable relationships and emotional pain. People with borderline personality disorder also tend to view things in extremes, such as all good or all bad. Their interests and values can change quickly, and they may act impulsively or recklessly. Other signs or symptoms may include efforts to avoid real or perceived abandonment, such as plunging headfirst into relationships or ending them just as quickly. A pattern of intense and unstable relationships with family, friends, and loved ones. A distorted and unstable self-image or sense of self. Impulsive and often dangerous behaviors such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Please note, if these behaviors happen mostly during times of elevated mood or energy, they may be symptoms of a mood disorder and not borderline personality disorder. Self-harming behaviors such as cutting. Reoccurring thoughts of suicidal behaviors or threats. Intense and highly variable moods with episodes lasting from a few hours to a few days. Chronic feelings of emptiness. Inappropriate, intense anger or problems controlling anger. Feelings of dissociation, such as feeling cut off from oneself, observing oneself from outside one's body, or feelings of unreality. Not everyone with borderline personality disorder may experience all of these symptoms. The severity, frequency, and duration of symptoms depend on the person and their illness. My fiance walked in. He didn't know I was doing a video, so now I have to try to find where I was. I'll start back here. Not everyone with borderline personality disorder may experience all of these symptoms. The severity, frequency, and duration of symptoms depend on the person and their illness. People with borderline personality disorder have a significantly higher rate of self-harming and suicidal behavior than the general population. People with borderline personality disorder who are thinking of harming themselves or attempting suicide need help right away. If you or someone you know is in immediate distress or is thinking about hurting themselves, call the National Suicide Prevention Lifeline toll-free at 1-800-273-TALK. That's 8255. And like I said, I'm going to put the link down in the description. So if you need to go and find these numbers again, they're going to be there. So you can also text the crisis text line hello to 741-741. And that's one I've used before. And the one that comes after that that they don't mention in here is 988. And that's the one that they use now all the time. And so I don't know when this was written, but 741-741 was the one that I've used in the past. Or use the Lifeline chat on the National Suicide Prevention Lifeline website. And I can click on that and put that in the description as well, because it's actual link. What causes borderline personality disorder? Researchers aren't sure what causes borderline personality disorder, but studies suggest that genetic, environmental, or social factors may increase the risk of developing it. These factors may include family history. People who have a close family member, such as a parent or sibling, with the illness may be at higher risk of developing borderline personality disorder. Brain structure and function. Research shows that people with borderline personality disorder may have structural and functional changes in the brain, especially in the areas that control impulses and emotional regulation. However, the studies do not demonstrate whether these changes were risk factors for the illness or if such changes were caused by the disorder. Environmental, cultural, and social factors. Many people with borderline personality disorder report experiencing traumatic life events, such as abuse, abandonment, or hardship during childhood. Others may have been exposed to unstable, invalidating relationships or conflicts. Although these factors may increase a person's risk, it doesn't mean it is certain that they'll develop borderline personality disorder. Likewise, people without these risk factors may develop the disorder in their lifetime. How is borderline personality disorder diagnosed? A licensed mental health professional, such as a psychiatrist, psychologist, or clinical social worker who is experienced in diagnosing and treating mental disorders, can diagnose borderline personality disorder based on a thorough interview and a discussion about symptoms. A careful and thorough medical exam also can help rule out other possible causes of symptoms. In diagnosing the illness, providers will discuss a person's symptoms and ask about family medical histories, including histories of mental illness. Borderline personality disorder is usually diagnosed in late adolescence and early adulthood. Now, see, mine was way, way into adulthood. I mean, I think in my 40s maybe is pretty, pretty way. And I have the feeling I had it. I just wasn't seeing the right doctor that figured it out. So occasionally, a person younger than age 18, may be diagnosed with borderline personality disorder if symptoms are significant and last at least a year. I feel sorry for that person having to live with that for that long before being diagnosed. What other illnesses can co-occur with borderline personality disorder? Here we go. Bipolar. That's me. They don't play well together. Borderline personality disorder often occurs with other mental illnesses such as post-traumatic stress disorder, PTSD, which I do have, These co-occurring disorders can make it harder to diagnose and treat borderline personality disorder, especially if symptoms of other illnesses overlap with symptoms of the disorder. For example, a person with borderline personality disorder also may be more likely to experience symptoms of major depression, PTSD, bipolar, anxiety disorders, substance abuse, or eating disorders. No, I don't have the substance abuse or the eating disorders that I'm aware of. Just maybe give it time. How it's just really hard having these disorders and they cross each other and you don't know what is causing the issues at the time. It's really hard. So how is borderline personality disorder treated? This is one of the questions I have because I've been told it can't be cured. I've been told it can go into remission. I told there's medication. My opinion is somebody's not doing their job. So with that, borderline personality disorder historically has been viewed as challenging to treat. It's just because I just said that. Both newer evidence-based treatment, many people with this disorder experience fewer and less severe symptoms, improved functioning, and better quality of life. It is important for patients with borderline personality disorder to receive treatment from a licensed medical health professional. Other types of treatment or treatment from a provider who is not appropriately trained may be ineffective or dangerous. And see, that's what I'm dealing with right now is the one that I'm seeing. She doesn't even talk about it. She doesn't, and the therapist, he doesn't talk about it either. And I'm being encouraged to change providers. So we'll see once what happens. Many factors affect the length of time it takes for symptoms to improve once treatment begins. It is important for people with borderline personality disorder and their loved ones to be patient and receive support during treatment. It is important to seek and stick with treatment. See, now nobody ever told me what treatment. So how do they expect me to get better if I don't know the treatment? Studies funded by the National Institute of Medical Health indicate that individuals with borderline personality disorder who don't receive adequate treatment are more likely to develop other chronic medical or mental illnesses and are less likely to make healthy lifestyle choices. Psychotherapy. Psychotherapy, sometimes called talk therapy, is the first line treatment for people with borderline personality disorder. Most psychotherapy occurs with a licensed, trained mental health professional in one-on-one sessions or with other individuals in group settings. Now, see, I don't do group. You'll never get me into a group setting. I've been there and done that and never again. Group sessions may help teach people with borderline personality disorder to interact with others and express themselves effectively. Two examples. Okay, let me take a step back. I'm not saying don't go and get group help. All I'm saying is it didn't work for me. It may work for you, but it didn't work for me. So I had to put that in there. I guess that's like a disclaimer. Two examples of psychotherapies used to treat borderline personality disorder are dialectical behavior therapy, DBT. This treatment was developed specifically for individuals with borderline personality disorder. I can never say these. DBT uses concepts of mindfulness or awareness of one's present situation and emotional state. DBT also teaches skills to help people control intense emotions, reduce self-destructive behaviors, and improve relationships. Cognitive behavioral therapy, CBT. This treatment can help people identify and change core beliefs and behaviors that come from inaccurate perceptions of themselves and others and problems interacting with others. It may help people reduce mood swings and anxiety symptoms and may reduce the number of self-harming or suicidal behaviors. Medications. Because the benefits of prescription medication for borderline personality disorder are unclear, medications aren't typically used as the primary way to treat the illness. However, in some cases, a psychiatrist may recommend medications to treat specific symptoms or co-occurring mental disorders such as mood swings or depression. Treatment with medications may require coordinated care from more than one medical professional. Now, if you have bipolar and this borderline, you can't take antidepressants because you cannot take antidepressants for bipolar. So I was waiting for them to say that they prescribe antidepressants. Medications also can sometimes cause side effects in some people. Talk to your provider about what to expect from a particular medication. Where can I find help? If you're not sure where to get help, a healthcare provider can refer you to a licensed mental health professional, such as a psychiatrist or psychologist with experience treating borderline personality disorder. If you need help starting the conversation, check out the tips for talking with your healthcare provider fact sheet, and I'll put that down in the description as well. So there's just other things, therapy for caregivers and family members. Having a relative or loved one with the disorder can be stressful. Imagine what it's like for us, but I suppose. And family members or caregivers may unintentionally act in ways that can worsen their loved one's symptoms. Although more research is needed to determine how well family therapy helps with borderline personality disorder, studies on other mental disorders show that including family members can help support a person's treatment. Families and caregivers also can benefit from therapy. I totally agree with that, because if they don't know how to treat you, and they treat you like you're Looney Tunes. Like they don't understand it. Anybody who's uneducated about anything, they're just going to assume things and they're going to just be different. So I think I'm just going to leave the link for this down in the description, and then you can go through and go to that link and look at the different links that's in here. There's quite a few. Okay. Family therapy helps by allowing the relative or loved one to develop skills to understand and support a person with borderline personality, focusing on the needs of family members to help them understand the obstacles and strategies for caring for someone with the disorder. So, how can I help a friend or family member with borderline personality disorder? Here are some ways to help a friend or relative.
The dryer has finished running.
I shouldn't do laundry while I'm recording, should I? Shit. Here are some ways. I'm sorry, it makes me laugh because doesn't it happen like every time? Here are some ways to help a friend or relative with the disorder. Take time to learn about the illness, to understand what your friend or relative is experiencing. Offer emotional support, understanding, patience, and encouragement. Change can be difficult and frightening to people with borderline personality disorder, but things can improve over time. Encourage your loved one in treatment for borderline personality disorder to ask about family therapy. Seek counseling for yourself. Choose a different therapist than the one your relative is seeking. Yeah, sometimes it works. Sometimes it's good to have the same one, actually. But that's just me. How can I learn more about clinical trials studying borderline personality disorder? Oh, I'd love to get into that. National Institute of Mental Health supports a wide range of research, including clinical trials that look at new ways to prevent, detect, or treat diseases and conditions, including borderline personality disorder. Although individuals may benefit from being part of the clinical trial, participants should be aware that the primary purpose of the clinical trial is to gain new scientific knowledge so that others may be better helped in the future. Researchers at the National Institute of Mental Health and around the country conduct clinical trials with patients and healthy volunteers. Talk to a healthcare provider about clinical trials, their benefits and risks, and whether one is right for you. For more information, visit the National Institute of Mental Health Clinical Trials webpage. I'm going to go check that out. So, I'm just looking here to see if they just have a bunch of information and resources and things like that. I will, like I said, put that link in there. And I know sometimes the links don't work if you put them in the description. So I'll also put them, I think it's an end card, or I'll put it in there somewhere where you can find it, because there are many links in there, and something there might be able to help you. And I hope that my videos help you. And if they do, I'd appreciate it if you'd subscribe, because I do a video every day and usually every night, very rarely in the day, because I need time to think during the day of what my topic is going to be for the day. So, and then when I feel ready, I do my videos. So I certainly hope you like and subscribe. And I always forget them because I usually don't say them. I'm just trying to start. After how many videos, I'm just starting to remember to say that, because I feel like people on YouTube already know how to do that. Maybe you're new. So then you can just subscribe and I'll be happy. But, you already viewed it. I hope you viewed the whole thing. I'm carrying on because this stuff makes me nervous and I get really anxious. I get a lot of anxiety. Not being in front of the camera, but honestly, I feel like I'm being judged and I have a hard time with that. So hopefully, like I said, you'll be getting something out of this, and I hope you'll subscribe. Subscribe? Is that right? See, I'm nervous. Even after all these videos, I still get nervous. So, because I will see you tomorrow, even if you don't subscribe. So you take care and have a great evening.